Welcome to the Growing Your Dental Business podcast. I'm your host, Penny Reed, and I'm excited to have with us today Kevin Henry. Welcome, Kevin.
Penny, thanks so much. I'm excited to be here.
Hey, you know what? It's exciting to be seen as we are now still, I will say, in the midst of the pandemic. Even though I want to say that it's in the past, but hopefully we're rounding a corner here. Some of you may be wondering, okay, who is Kevin Henry? So I've known Kevin for years. I met Kevin at an American Association of Dental Office Managers conference in Minneapolis, maybe in 2007.
The Mall of America.
The Mall of America, where I got in trouble for running.
Absolutely.
Yeah, I got in trouble for running. I don't get in trouble for running in places much anymore the older I get. But so Kevin is the co-founder of Ignite DA, which I'll have you tell us more about that in a moment. And he is also the editor-in-chief for drbicuspid.com. Previously, he has been in editorial roles with Dental Products Report and also a little publication you've probably heard of called Dental Economics. So just to name a few. So Kevin, tell us more about Ignite DA and really just about this, which I think is awesome, this incredible passion and vision that you have for dental assistants.
Yeah, thanks, Penny. I appreciate that. Yeah, Ignite DA has been around for about 3 years now. My partner, Dr. David Rice, and I founded it. Dave has done such an incredible job building up Ignite DDS to really target and help those young dentists get off the ground. And, you know, he and I were having a dinner one night in Buffalo, and our wives were there, and we were like, you know, wouldn't it be cool if we had the young dentists and the young assistants grow up together and learn from each other? And that's when Ignite DA was founded. And then we discovered that it's not just something that the young assistants needed, it was assistants of all ages. Mm-hmm. And, you know, there's over 320,000 dental assistants in the country today. They are the biggest dental healthcare group out there. And so it's been my passion since 2005, actually, to speak to them at meetings and to do webinars and podcasts like today to talk about why they play such a critical role. So anytime I get to do that, it's a good day. And I appreciate you letting me do that, Penny. Thanks.
Oh, absolutely. Absolutely. And also, we did not mention that you have a book.
I do. Yeah. Battling and Beating the Demons of Dental Assisting. You know, you have Bitter Baby. I have the Demon of Dental Assisting, you know, to whack around. And that's something that I talk about and have for quite a few years. And I'm very thankful to be able to do that. And that's basically my presentation in book form. So thanks for mentioning that.
Sure. So, you know, one of the things that I learned early on in my career, and I have to be reminded of from time to time, because I have a pretty independent personality, as I know a lot of dentists do, right? And you think, okay, well, I'll just do it myself. Sure. Well, the I'll just do it myself, right? When dentistry was first born, you know, where it was not uncommon for dentists to work by themselves, and then later they added on an assistant, and then later they brought in hygiene, you know, and this whole concept of team is expanding. But if we're really going to accomplish great things, we do that with and through other people. And you know, who better that has the ringside seat or the right up next to seat with the doctor than the dental assistant. So we talked about that this would be the episode all about dental assistants.
Yeah.
Tell us a little bit about, because, you know, from what I hear in coaching doctors, and I work with teams as well, is, you know, often that concept of money comes up, right? Which, hey, money's important. But as you and I were talking about, you wanted to share, money's not the be all end all. So could you tell us more about that?
Absolutely. You know, and let's just lay all the cards out on the table. The dental assistant is the lowest paid person in the practice. In 99% of the practices out there, that's the case. You know that, and the dental assistant knows that as well. But one thing that I have learned through the years, we've done countless surveys with assistants, the thing that motivates them to keep coming back every day, even though the money really isn't there, is that they enjoy working with the patients, is that they enjoy being a part of this process of improving their oral health. And, you know, a quick personal story here. I will tell you that my mom was a dental phobe for a number of years, had a very bad experience, and it was the dental assistant and her just simply being kind and telling her, I'm going to be here with you through this procedure. We're going to make it together. That's what got her not only back into the practice the first time, but has kept her coming back since then, because she knows that that dental assistant's going to be there no matter what.
Mm-hmm.
And I think it's important for dentists to understand that the dental assistant is such a key component of the patient dental practice relationship. And could you throw a couple extra bucks an hour their way? Absolutely. But you know what? That's a Band-Aid. If you don't have proper systems in place, if you don't have a good attitude in place,
Mm-hmm.
if you don't have somewhere that they enjoy working and that they feel valued, a couple of extra dollars is literally a Band-Aid. And so that's one thing that whenever, as you mentioned, my work with dental economics, DPR, and now Dr. Bicuspid, I try to remind dentists that the culture of the practice, making
Mm-hmm.
sure that everybody is on the same page, everybody feels valued, everybody feels heard. I understand that for some dentists out there, that's kind of fluff and it's like touchy-feely. But I can tell you, to your team members and to your assistants, they've told me for years that that's the reason that they'll run through a brick wall for you eventually, is that they feel like you will do the same for them.
Mm-hmm. Absolutely. Well, and there are some ways that in some states that dental assistants can get enhanced
Sure.
certifications, expanded function, which can give them the benefit of earning more. But in many states, that's not even, you know,
You're right.
that's
Yeah.
not even an option for them. So no,
Yeah.
I think that's very true. And I think it's true of any position, but especially when you're not earning as much, is ultimately either a great boss or a bad boss. Usually when people leave a workplace, it's not all about the money. It has an awful lot to do with how they look forward to coming to work every day.
Well, and you touched on COVID-19 and the pandemic, whenever we started this, and I will tell you, so many dental assistants reached out to me whenever everything first went down and dental practices were closed. They said, you know what, I'm looking at this as a reset, because I'm not sure I want to go back to that practice. I
Mm-hmm.
may find somewhere new, and they had been having fear of having this talk with their dentist that they weren't exactly meshing with, and all of a sudden it was like, oh my gosh, so that was the silver lining for so many of these assistants. And I know,
Mm-hmm.
talking to a lot of practices, there's been a lot of musical chairs as far as which team members come back, which didn't. And maybe if team members were reluctant to come back, maybe that's a little bit of an eye-opening experience for what your practice is set up like, not only as a business, but also in terms of that team that you mentioned
Mm-hmm.
earlier.
The environment for sure. Well, so I noticed this pre COVID-19, finding great dental assistants. In other words, and there can be challenges also in finding great admin team members, because there aren't schools that administrative team members go to that, oh, okay, well, I graduated from the blah, blah, blah School of Dental Administrators. But finding and keeping great dental assistants is a challenge. What tips do you have to make
Yeah,
that better?
I've been asked that so many times, and the biggest thing that I will always talk to dentists about is that if you can find a great dental assistant, man, that's the diamond. That is the diamond in the coal mine. There's no question about it. But so many times it's about finding an assistant that you believe in, you mesh with, you feel like that you have a connection with, and then pouring that support into them to build them up to be that great assistant.
Mm-hmm.
And I guarantee you, once you're able to do that, the dental assistant is going to be very reluctant to leave, because you have invested in him or her. You have showed faith in him or her. And so I always caution dentists to make sure that you're not setting your sights so narrow that you're overlooking what could be a great assistant who just needs a little bit of a push or a little bit of support along the way.
Mm-hmm.
So the best piece of advice that I always give is, the interview process, I think, is so vitally important. Whenever you bring somebody new on board, don't just run through it. Don't just ask them, the vanilla questions. What are the things that matter to you as a dentist, and see if he or she is really answering those questions, first of all, with passion, and
Mm-hmm.
second of all, with knowledge. And if you find somebody like that, then I think it's important for you to sit down and say, okay, I'm going to bring you on board. We're going to do this. How do we build each other up? How do we build up this business together? Because I'm a firm believer that whenever the business does well, everybody in that business should do well also.
Absolutely. Absolutely. Well, and if you hear what I do, and I mean, hey, who doesn't want the best person out there that's already trained.
Sure.
Well,
Absolutely.
I'm the prime example of someone that had no dental. I actually worked for the dentist that hired me maybe 4 weeks one summer when I was in college, like just kind of putting away charts. I was terrible. I mean, and I didn't learn, I still didn't know tooth numbers, but I mean, I had been there long enough to say that I had darkened the door of the office. But for him to have offered me a man, and he said, look, we're not going to call you the office manager originally. I didn't have any dental background whatsoever. And, I'd be curious to hear your thoughts on finding somebody with the right attitude
That's a lot
that,
of,
that doesn't have the resume yet of
yeah.
experience.
I think if you ask a lot of us out there, I'm like you. I wasn't born and raised in this industry. I got brought into it eyes wide open going, what am I getting myself into here? But there were enough kind people out there that took me under their wing and said, let us teach you, let us show you. And, 20 some years later, here we are talking to each other. But I think it's so vitally important that if you look for people who possess the qualities that you want to have an assistant, you can find them anywhere. And certainly clinical is important, certainly. But I am also a big believer that if that assistant hadn't been a people person and helped my mom through that procedure, she wouldn't be back. And it didn't matter how great the dentistry was. It didn't matter how kind the dentist was. It was the fact that that dental assistant patted her hand every once in a while and said, are you doing all right with them? And things like that, that's what sticks in their head. So I think it's more looking for qualities outside of the dental sphere so often than it is how great are they going to be about suction or whatever it might be.
Right. Or do they already know how to make a temporary crown?
Exactly. Yeah, I agree completely.
Well, could you share with our viewers and listeners, because I know you got your finger on the pulse of what dental assistants think and how they're feeling, and you touched on a little bit during the pandemic, but just overall, what's important to them? What are some of the specific things that motivate them? And then any other things from their perspective that you think would be valuable?
Yeah, I will tell you that I think those first few days and weeks of the pandemic were very eye-opening for a lot of assistants whenever they were, and I know so many practices furloughed their team members. That was the choice that they had to make. But some of them did it without communicating about what's next, what's coming. Hey, you're still valued. We're still going to do this together. It's just going to be a little bit of time till we figure it out. And that's what I heard from so many assistants are that whenever there was communication and there was kindness behind it, that made such a lasting impact. And I think that, I talked earlier about those who were hitting the reset button. For a lot of dental assistants, what was said or what wasn't said in those days and weeks afterwards really cemented their decision about which direction they were going to go. And so I will tell you that a sense of purpose, a sense of value, a sense of belonging, again, those things may sound very esoteric, but I will tell you for dental assistants and for dental team members, it's important for them that you express to them how important they are. And I did a survey whenever I used to run Dental Assisting Digest as part of the dental economics family. And I asked 1,000 dental assistants for 3 consecutive years, what's the meanest thing a dentist ever said to you? What's the nicest thing a dentist ever said to you? And the meanest would take a whole other podcast, trust me. But the nicest every year that we did it for 3 straight years was thank you. Wow. And that blew my mind that it was just those 2 simple words. And yet I constantly hear from assistants, I don't feel appreciated. I don't hear those words. I say that in my lectures all the time. And I have seen assistants literally tears start welling up in their eyes because they long for that. And so one piece of advice I would just give to anybody who's watching or listening to this is if you're not saying thank you right now to your team members, try it. Just try saying, hey, that PPE is sweaty. We all got through this, but still with Mrs. Jones at 3:00 today, you really came through. And I just want to say thanks for that. And I guarantee you're going to be surprised what a difference it makes, not only in their attitudes, but just those looks that they get in their eyes as well. I promise you.
Sure. It, that is one of those, honest and sincere appreciation, which years ago I became a Dale Carnegie trainer. So, if we were bored, we should have another podcast episode where I see if I can remember all 31 of those principles. But principle number 2 is to show honest and sincere appreciation. And people, you want people to never want to leave you. Right. I mean, we know that people move, they make career, they have babies, they retire, they have career changes. One of the other things that I've seen that's so powerful, and I've have a lot of clients that are naturally this way, and I would say this, and would love to get your input as well. For some, it's a skill that has to be worked on and acquired. It's difficult for some people to give compliments.
It is. You're right. And they say it with gritting their teeth
Yeah,
usually, because
yeah,
it's a very uncomfortable thing. And to be honest, those are the people that we've talked about for a little bit here, that maybe that culture needs a little work, or
yeah,
that
yeah.
environment needs a little improvement. Sure.
And I've got client, it's like, all right, what do you need to do? I've had some that are like, okay, I can't do it. What if I start with Post-it notes? I'm like, you know what? I think it's better for you to give them sincere praise on a Post-it note as a starter than not at all.
Yeah.
Right. And or start out with pennies or paper clips or whatever in your pocket, and you do 3 a day. But to give a sincere compliment in front of the patients, I love it when I hear that happen. It's like, oh, Nina, you remember Nina? Nina's assisted me today. Oh, and I'll hear them say, Nina, beautiful job on that temporary, right? Or Nina, thank you so much. You always have that exactly where I need it. It doesn't even have to, it's like, well, I don't have time to do that. It doesn't take extra time.
It doesn't, and I will warn some out there, because I had one dentist tell me, well, I show my assistants all the time that I thank them. I give them Starbucks cards and everything else, and that's awesome. But you know what? At the end of the day, all of a sudden that becomes just like a
It's a system.
it's a system. It's not from here.
Mm-hmm.
So and I know not everybody, as you said, is warm fuzzy and kumbaya, and we're all going to get s'mores afterwards. But
I
it.
love s'mores.
Oh man, I'm telling you what, we got s'mores coming this weekend. I'm so excited. Anyway,
Awesome.
um, but I think that if you will just work on those appreciation skills,
Mm-hmm.
I think, and it comes from here. Then I think it'll be a key, and maybe turn your practice around in the second half of the year. Who knows?
Well, and one of the coolest things, this, and I'll tell this, and then I'll let you kind of bring us home here. Reminds me when I worked in the dental practice, which I was brought in to be an office manager, but I wasn't one immediately. I was one of the, oh, I was always one of the gang, right? But I came in, I was a rookie, and had to learn, and we wound up working with a consulting group. That's how I found out that there was such a thing as a dental consultant. I was just confused because I thought all the team members were going to like me. And then later I realized that a lot of dental team members don't like consultants. But anyway, um, he was given an assignment by our coach, and I knew it was coming, but I didn't know when. And it was to do something for the team. And so our doctor got us all a single carnation, like not a fancy flower, right? Not even a rose. It was a carnation in a vase. And then we all got handwritten notes, and I had mine. I lost it in a move, right? But he took the time, no telling, there were 10 of us, no telling how long it took for him to write them. But we all got a note about, hey, I appreciate you. That meant so much to me. I kept it for 15 plus years. And I still remember it. And it was because it was how he felt. And so, I think digging deep and asking yourself as the business owner or manager, or who may be listening, that, associate dentist, if you really want to bring out the best, find something. Maybe if you're focused on the 10 things that they're still not doing the way that you want them to do, praise them on the things that they're doing well.
I love that. There's one or two things that we all do great. I mean, and those of us in the industry know that about each other, and we know who to refer to for certain things. And I think the same thing in the practice goes. When your assistant has gone above and beyond. That sometimes he or she may fish the handpiece out of the trash. It happens, right? I mean, let's be honest here. These aren't glamorous jobs, But when they will do things like that, it never hurts just to say, hey, thanks, I appreciate that. I know you stayed late to get the office ready for Mrs. Jones to be here at 8 o'clock this morning. Little things like that, absolutely. And I love the fact that that handwritten note stayed with you for so long,
Oh,
because
it did. I wish I still had it.
I don't think we understand as humans how much just little things like that can mean to the other person. So that's
Mm-hmm.
very cool.
Well, so awesome. So tell us, as we're kind of bringing it home,
Yeah.
how does Ignite DA work with dental assistants? What are ways that they can get involved?
Sure. Well, it's first of all, it's all free. So, hey, that's a good thing, right? So a couple things that if you want to have your dental assistants be empowered, you want to have them understand just how much they matter in the practice. I have a podcast called the Dental Assistant Nation podcast. Again, completely free, very similar to what you and I are doing today, focused on the DA and his or her needs. So would love to have them subscribe to that. Ignite DA is on Facebook. And what we try to do, and I'm anxious for dental meetings to start back up and everything else. We're lucky enough to work with Yankee Dental on a full day track specifically for assistants, Midwinter, Hinman. So we're everywhere, and we really love to work with assistants, but you can always drop me a line through the Ignite DA Facebook page. And if there's ever anything I can do, advice, whatever, I'm happy to do that. Just let me know.
Awesome. Awesome. Well, Kevin, thank you so much. And we will put your contact information in the show notes. But if someone did want to reach out to you, you've got the Facebook group you mentioned. What's another great way for people to reach you?
Kevin.henry@igniteda.net certainly is an easy way. I'm not too hard to find. Twitter, Facebook, LinkedIn, Instagram. I'm about everywhere, and I love to talk to people and see what I can do to help. So please don't hesitate.
Fantastic. Well, thank you again so much for your time and for just really reminding us again the importance of the team, and especially shining a light on the dental assistant who is very often an unsung hero in the practice.
Well, thanks to people like you that actually let us talk about that, because I think it's so important as we get back to work in dentistry that we remember how important everybody is. Thank you.
Absolutely. All right. Take care.